Assalamu alaikum everyone. I hope all the students are okay. That's fine. So today we are in session number 7, my dear students, and I hope that you have done wonderful when you are sitting alone and when you were practicing what I suggest and what I request you. At the same time, I can expect now you have got better understanding of phonetics, what is phonetics and what are the branches of phonetics. At the same time, you must have tried to understand that what is articulatory phonetics, what is acoustic, and what is auditory phonetics. Not only this, but I'm sure that you must have tried to understand the speech organs and the airstream inside us, or how the speech sounds are produced by human beings, and what are the roles being played by different speech organs. But the best part is that you need to do that you have to connect each and every session with the other one. It becomes difficult that if you simply understand one session in isolation. I mean to say that you don't connect the present session with the previous one. It's very important that you have to connect each and every session. As I told you, that all the sessions, the entire sessions based on this particular course, they are interconnected, so please do not try to miss any link. So today we are going to have something new, and today is our session number 7. Welcome to session number 7, week 4. I already told you that we are in session number 7, that is week 4. Remember, the technical things are now you're going to face. As I told you, for example, during session number 6, that yes, definitely when we'll be jumping to the end of the course, that is not jumping to the end of the course, but in fact we are jumping into more technical things which we need to practice, which we need to understand. Definitely we understand after practicing a lot, and I hope that today again you shall try to practice whatever the activities I request and I suggest to you. All right, so welcome to session number 7, week 4. Let's talk something about the things we are going to discuss today, or we are going to understand today. I mean the topics which are reserved for this particular session, that is session number 7. We shall try to understand the division of consonants. We shall also try to understand the organs of speech, and definitely we shall also talk about the classification of English consonants, but separately. So this is the time to understand each and every consonant separately. What is the category and what is the class of each and every consonant, especially of course English. Okay, my dear students, let's try to introduce ourselves to consonants or English consonants. At the same time, I expect that you've got the basic knowledge and the basic understanding of phonetics. And if you just refer to statement number 1 that is on the top, you can understand it says that since we assume a knowledge of the basics of phonetics, the articulatory classification of consonants will only be touched upon. We already know that what is phonetics and what are the branches. But remember our primary area, which I was talking about during the previous session, during session number 6. In fact, the significant part in fact is played by the articulatory phonetics. Why? Because much has been worked on this area, because everything is very much concerned with the way how we produce speech sounds. And it is why it is more important, because so far as your acoustic phonetics is concerned, or for instance auditory phonetics, and of course the functional use of this particular branch is concerned, it's very important that how the speech sounds are produced. And it is possible at the time when the speaker, I'm talking about the learner, since you and me, not the general speakers who are speaking English, because they have got no concern with this, that what is the articulatory phonetics, since we are the students of phonetics and phonology. That's why this is our primary area, to understand that how the speech sounds are produced. And when I say speech sounds, what are the speech organs involved in the in the production of each and every speech sound? So that's why it's very important that we shall be talking about, and rather with reference to articulatory classification of consonants. The second statement of this slide tells us that according to their articulation, the consonants of English can be classified along three terms. So the three terms available, and we read about them. And what are they? Number one is the voicing, second is the place of articulation, and the third is the manner of articulation. You can understand that what is voicing, we had long discussion on this, and we try to understand, both you and me, what is voicing. And we reached the point, yes, exactly, voicing means when producing any speech sound, vocal folds are vibrating, that is a voiced sound. But if at all the vocal cords or the vocal folds are not vibrating, that means that is a voiceless sound. And I think during the last session, and of course the previous session, there was session number 5, when I told you that in English we have got some voiced consonants and some voiceless consonants. And I hope you remember the number of voice sounds. Yes, exactly, they are 15. And I'm sure at the same time that you know how many voiceless consonants are there. Of course, there are 9. So we understand about voicing that results from vocal cord vibration. This is what I'm trying to tell you again, that voicing, yes, exactly, you should not forget it, that voicing, and time and again I said that whenever there is a question from outside world on you, that what is voicing, your answer should be different. Why? Because your major is English. So this time you understand what is voicing, and during the previous session we tried to understand the place of articulation. The place of articulation, and we talked about certain sounds. Do you remember? That's great. It is further elaborated in this slide that for the present purposes, it is sufficient to say that when the vocal cords vibrate, we get voice sounds, and when they do not vibrate, that means we get voiceless sounds. So time and again, I'm referring to 15 voice sounds, and of course 9 voiceless sounds. It's very important that this time I think and expect that all of my listeners are very much understanding what is voicing, because without understanding this, it is difficult to classify the consonants, because now we are jumping into the world of manner of articulation, because it is written here, the place and manner of articulation refer to where and how the airflow is obstructed during the production of the consonant. Now, after having done enough regarding voicing, now it is the time to understand, in fact, what happens is the place and manner of articulation. So both these two areas, or two bases, or two aspects of phonetics, definitely when we talk about the classification of consonants, these two areas become more important to understand. So we try to understand, because these two aspects, the bases, refer to where and how the airflow is obstructed. Where and how airflow is obstructed. When? During the production of the consonant. So these two aspects, so these two bases, in fact, they try to, they make us understand what is the class of the consonant, the place and the manner. The place and the manner, because both are concerned with the airflow. You know, as I told you, the very simple question, what's the difference between a consonant and a vowel? And the answer was, all right, when we produce a consonant, what happens? The airstream is blocked somewhere in between our lungs and lips while we are producing a consonant. So this is what I'm referring to, that the place and manner of articulation primarily refer to where and how the airflow is obstructed during the production of the consonant. So these are very important points you must remember, so far as this slide is concerned, and whatever we have done so far. All right, that's good. Well, my dear students, we've been talking about certain speech organs, and definitely we were talking about the places of articulation, of course, the manner of articulation. But I want you to understand first of all this slide, and definitely we shall try, both of us, of course me and of course you, we shall try what's written over here. Let's read this slide together. There are four major places of articulation: labial, involving a lip or both lips; coronal, involving the blade of the tongue called the corona; velar, the back of the tongue moving toward the soft palate or velum; and glottal, involving some kind of a manipulation of the opening between the vocal cords and the larynx called glottis. All these parts are mentioned in the next slide. Now it's very important to understand what does it mean when we say that, all right, there are four major places of articulation. That's why in the previous session I picked up some of the sounds. For example, I picked up bilabial, I picked up labiodental, then dental, do you remember? Then I picked up velar and glottis. Now here you have to focus on the four broad areas, the major areas, the places of articulation. The first one is the labial. What's the role of our lips? Sometimes it is one lip, sometimes both the lips are working. For example, when I say one lip, that means I am touching upper teeth on the lower lip when I am producing the sound fur, or maybe I am producing the sound fur. Are you getting my point? And then the second area, the second part, that's the coronal. All right, the tongue. The tongue. As I told you that the most active part among the speech organs is our tongue. And of course we have given tongue the new name, that is the articulator and the active articulator. Most of the speech organs are in fact the passive articulators and allow the active articulator to come close to them to produce a sound. As for example the case of upper teeth, they are just relaxed, they are sitting, but they are allowing tongue to come close to them. And the tip of the tongue when touches, right, and we start producing the sound th or that. And then the third area is the velar area, right, the soft palate. I'm talking about the alveolar ridge, where we have got a hard palate and we have got soft palate, what we call velar. And the fourth major place of articulation is glottal, something that happens in the vocal cords. And of course you remember the voice box. Yes, exactly, that is the point where, you know, everything is processed. When the airstream is coming from the lungs, of course that is the first spot, first place, first stage where the things are, of course the airstream is processed. All right, so I hope that the answer to the question, whatever the question is, that what are the major places of articulation, your answer should be that there are four major places of articulation. The other ones are of course the secondary, they work under them. Yes, under labial, coronal, velar and glottal. Labial, coronal, velar and glottal. I want you to repeat after me. The first major place of articulation is labial. Labial. The second is coronal. Coronal. The third is velar. Velar. And the fourth is glottal. Glottal. So they are labial, coronal, velar and glottal. Good. Now I want you to focus on this slide. You have seen this slide earlier, but now watch what we've talked in the previous slide. Yes, labial, of course. You can see the lips, the tongue, the velar, and the glottal. So far as alveolar, post-alveolar, and palatal are concerned, they are important. What is the major role and played by what? Remember, the major role is of tongue. It moves towards sometimes hard palate, sometimes the post-alveolar area, right? Sometimes the palatal area. So you can see labial, isn't it? The lips are there. As I told you, for example, that all the time we are focusing the speaker's lips, how he or she is moving his or her lips, that's the outcome we are with. But what's going on inside, that is the tongue. The major part is played by tongue, as I told you many a time. So the labial area, tongue area. So we have got 4 parts, for example, the tip of the tongue is there, front there, center is there, and the back of the tongue is there. All the time it's moving. Sometimes it is going upward, sometimes it's touching the teeth, sometimes, all right, it's allowing the air without any blockage, but it is trying to block the airflow in accordance with the need of the speech production, or in accordance with the speech type, the sound type. Whatever the demand of the speech sound is different, it starts playing a different role. And then finally, so right side you can see velar and glottal. Velar and glottal. Velar means the back area, the velum area, the velum area, soft palate area. And then the glottal, as I told you, that in English we have got only one glottal sound, such as h, right? There is absolute flow of air. There is no blockage at all. There is no obstruction. But that is the part played by, wonderful part played by this place. Why? Because it is to process the airstream. So you must not forget the importance of this part, the larynx part, all right? So that is the processor primarily, all right? So you can see that where you have the other areas, but the 4 places of articulation, you must not forget. You must not forget. The lips area, the tongue area, the velar area, and the glottal area. All right? I hope you remember that we are classifying English consonants, and of course our major area that we have to talk about the manner of articulation. We have talked about the places of articulation. We've talked about voicing, and in detail we try to understand each and every base, and of course out of 3 bases. I hope you remember that when I said that we can classify the consonants on the basis of either voicing or place of articulation or manner of articulation. Now, this time I think we have to talk about manner of articulation when we are trying to classify consonants. So what is the way to classify a consonant so far as the manner of articulation is concerned? First of all, I would like to read the statement for you so that we may be able to understand while analyzing what is behind this statement. It says, there are several possible divisions of consonants. There are several possible divisions of consonants. You must not forget that the first topic of today's session is that we have to divide the consonants. So that's why it is written here that there are several possible divisions of consonants. For example, some consonants are oral, some consonants are oral. The air escapes through the oral cavity and the mouth. Are you getting my point? Some consonants are oral. The air escapes through the oral cavity and the mouth. Others are nasal. The air escapes through the nasal cavity, the nose. Now, we can divide the consonants now as the oral and the nasal. So one category, one class of our consonants according to the manner of articulation can be either oral or nasal. I hope you remember when I talked about three sounds. Do you remember? M, N, and ing. And I said, all right, this is the nasal cavity through which they find their way out. So, some are oral, some are nasal. How? Because any sound, any consonant sound, while producing, when the end is, of course, the air is getting out through the lips, that is called the oral sound, and that means oral consonant. But any consonant sound which makes its way through the nasal cavity, such as m, n, and ing, that is called the nasal sound. I hope you understand this statement now. And then, if the articulation involves a total obstruction of the air in the larynx or the oral cavity, that is, if the air is stopped for a short period, we get stops, or in other words, non-continuant sounds. Now the first thing is we are trying to understand stops. What are stops? Which we have given non-continuant sounds. Stops. Remember, when there is a complete blockage, complete obstruction, there is some sort of pressure built inside mouth, and the air gets out with the pressure, with a burst, that is called stop. For example, if you use the sound p, or if you produce a sound p, so you can feel obstruction, total obstruction of the air, total obstruction of the air in the larynx or oral cavity. Somewhere from larynx to oral cavity, what happens? There is a total obstruction of the air. That's why we are producing the sound p. Not only p, but if you produce the sound b, for example, you just find the same thing. So what are stops? In fact, what happens that we find the total obstruction of the air. So somewhere in between the larynx, of course, or the oral cavity. Yes, exactly. Larynx is the spot which I told you that processes. What happens after processing the airstream? It has to send the air through, of course, the medium of windpipe. What happens? Either it goes to the nasal area or the oral area. So what happens when we talk about the stop sounds? They're also known as plosives, 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 plosives. You can feel some sort of burst affair, which I have shown you, I think so, in the previous sessions. Yes, I have shown you, and I'm sure that you can recall. So there is pressure and there's a burst affair. You can feel it, all right? You can just put, for example, a piece of paint in front of your mouth and try to produce the sound p. Yes, p. When the air pressure is out, when the burst is there, what happens? It can move your piece of paint. Yes, you can do it now. You can stop the demonstration and you can practice it. Yes. When I use the term stop, at the same time I said non-continuant. If it is not continuant, remember what this statement says. Otherwise the sound is continuant. For example, one continuant is L sound. So let me read this statement and then we should try to understand. Otherwise the sound is continuant. If it is not non-continuant, what is the outcome? Continuant, right? Otherwise the sound is continuant. One consonant, L, is special. Although the tip of the tongue touches the alveolar ridge, which normally results in non-continuant articulation, in this case the air is able to escape along the side of the tongue. The name of this manner is lateral, and therefore it is generally assumed to belong to the continuants. Now it's very interesting to understand. We were talking about non-continuants, right? Non-continuant. But if air is not totally blocked, obstructed, what happens? of course we are left with one sound, that is L sound. And the phoneticians have given a special name to this sound, that is lateral sound. There is only one lateral sound, in fact. Why? Because air is escaping somewhere along the sides of the tongue. You can produce this sound L, L. So air is not obstructed absolutely, but along sides of the tongue, these two sides are allowing the air to go out. L, long, London, lime, Lahore. So L sound. So that's why this is what I was telling you, that it is known in the manner of the world, in the manner of articulation world, it is known as lateral sound, because it is what? It is continuant. Continuant in the sense that air is allowed to pass and it passes away. Yes, definitely you can understand that air is out. Yes, exactly. The sides of our tongue, they are allowing this this sound, or maybe while we are producing this sound, that the air can go out. So that's why it is not continuant. It becomes continuant, right? Because of this, and this is the only sound, one L sound, and that's why this sound is known as lateral. So that the manner of articulation is concerned, if somebody puts you a question and asks you how many sounds, or what is a lateral sound, first of all you can tell the sound, and then why it is called lateral. You have to give the reason behind this, right? Good. My dear students, remember that consonants are divided, as mentioned in the coming slides, on the basis of the articulatory points at which the articulators actually touch, or at their closest. The classification of English consonants according to the place of articulation. Remember, in the coming slide we should try to understand what is the manner of articulation so far as the all speech sounds are concerned. But actually we have to understand one thing, and that is the articulators, when do they touch each other or one another, or close to each or close to one another. That's very important, because the place of articulation, remember, the place of articulation is very important. What is the position of our articulator? What is the position of our speech organ? This is what is very important to understand when we want to classify, or when we want to divide the consonants. It's very important, because these are the articulatory points. Articulation, how the sounds are produced, what is the role of each and every speech organ, what is the role of every speech organ during the production of one or all speech sounds, especially we are talking about consonants. So you must remember, all right? While talking about the place of articulation, I refer to speech organs. I think it's a time to refresh ourselves so far as the understanding of organs of speech is concerned. It's very important that this diagram, first time you are looking at this diagram, this is very important diagram. Now you can see on your right, that's very important to understand, three broad areas are there. One is the vocal tract, second is larynx, and the third is the lungs. I have been talking about the role of speech organs starting from our abdomen. I told you even abdomen, and of course some of the muscles, and I told you name diaphragm. Yes, exactly. Some muscles, they are pushing the lungs, so that the lungs may be able to push the air outside through the windpipe to the nasal area or to the oral area, oral cavity or nasal cavity. It's very important. Now you can see the human body sketch, and abdomen is there, abdomen part is there, definitely. On the top of abdomen we can see lungs. That's why, of course, diaphragm is also mentioned there. Some muscles are there which are supporting lungs. Now I would like to talk about, first of all, lungs. The family head is lungs. Understanding organs of speech is our area to understand so far as this slide is concerned. I want you, all of you to focus on this slide, and I want you, please remember, please store in your mind what you are seeing at this time, because I am trying to make the things clear. In the coming slides, what happens when I talk about any sound, you should be able to think and recall, all right, this time this part of our body is playing a role. So lungs, you can see. Abdomen, of course, diaphragm, rib cage, okay, true vocal cords and false vocal cords. I'm not talking about false vocal cords, I'm talking about only vocal cords. The lung area, the lungs area, the lungs area. Then, for example, larynx, and then vocal tract. Now, when we talk about the sub areas working under these broad areas, vocal tract, larynx and lungs, you can see some names there. You can see some spots there. You can see all the speech organs which are contributing to produce human sounds, of course speech sounds. Starting from diagram and going upwards, first is rib cage, vocal cords, tongue, lips, palate, nasal cavity. And on the other side, oral cavity, velum, pharynx, epiglottis, esophagus and trachea. The windpipe, of course. Now this is what is the entire picture of speech organs. If you want to understand all the organs of speech, this slide, this diagram is a must for you people. It's very important that we must be knowing that what are the areas fall under lungs, the larynx, the vocal tract, and you can see that all work together. There is a coordination of each and every speech organ when we are producing speech sounds. So it is not only phonetics that it talks about articulatory, it talks about acoustic, it talks about auditory, and of course a functional. Remember, this is the importance which I have been emphasizing during all these sessions, that you must try to understand what are the speech organs, what is the location, what is the place they are inside our body. Okay? Now this is what I was talking about. We are going to classify English consonants. My dear students, you've got a table in front of you. You can see the 3 columns. On each column, on the top of the column, now column number 1, it is written classification. Column number 2, articulators. Column number 3, examples. Now on left side you can say what? Bilabial, dental, labiodental, alveolar, plato-alveolar, platal, velar, glottal. Now I shall try to give you the class, then I'll tell you what are the articulators involved, and then I shall tell you something about the examples. I hope all of you are with me. Now let's start to understand the classification of English consonants. The first is bilabial. Upper lip and lower lip are working. Now you can recall, as I told you, the place, the position of each and every speech organ. Upper lip and lower lip. The examples are P, B, M, W. I repeat, classification is bilabial. Articulators are upper lip and lower lip. Examples are P, B, M, W. I told you that were, sometimes people believe that it is half bilabial, but I am saying it bilabial for the time being, all right? Second, dental. Teeth and tip of tongue, they are involved, and the sounds are th, the, th, the. The next category and next class is labiodental. Lower lip and upper teeth are involved, and the sounds are f, v. The next class is alveolar. Alveolar teeth ridge and tip and blade of tongue. These are the articulators involved. The examples are t, d, s, z, n, l, r. The next class is platealveolar. Hard palate, alveolar and tip, blade and front of tongue. And the examples are ch, j, j, sh. The next class is platal, hard palate and front of tongue. And the sound is y. The next class is velar, soft palate and back of tongue. And the sounds are k, g, ing. Do you remember in the previous session I said, all right, sometimes we are not doing the entire of the things. Now this is the time I'm presenting you the entire of the thing. When I say velar, at that time, for example, we touched only k and ing, but we left, for example, g. Now you are understanding that the velar sounds are three. And what are the articulators involved? Soft palate and back of tongue. And the sounds are k, g, ing. And the last class is glottal, vocal cords. And there is only one sound, h, h, h. Now let's understand each and every class separately. And this time I need practice from you people. Okay? Let's start with number one, bilabial. What are the articulators involved? All right. And the examples are p, b, m, w. Bilabial classification, articulators, upper lip and lower lip. Examples: p, b, m, w. I want you to write some of the words, then pronounce them and record your own voice. Okay? Our next class is dental. What are the articulators involved? Teeth and tip of tongue. And what are the sounds they're producing? Th, the, th, the. I repeat, the class is dental. The articulators involved are teeth and tip of tongue. And the examples, of course, the sounds th, the, th, the. Next class is labiodental. labiodental. What are the articulators involved? Lower lip and upper teeth. And the sounds f, v, f, v. I repeat, the class is labiodental. The articulators involved are lower lip and upper teeth. And the examples are f, v. What are the examples? What are the sounds? F, v. Our next class is alveolar. Alveolar. My dear students, I would like to suggest that not only this, what you are doing with me, but I want you to write many words as you can. I'm not saying the list of hundreds of words, but at least couple of dozen words you can write, and you can produce the sounds. And you can focus. Yes, exactly. You can write the word and you can mark by underlining the place where you find that particular sound. So the next class we have is alveolar. And I told you that you can pronounce this word as alveolar. Alveolar and alveolar. So the next class is alveolar. What are the articulators involved here? Alveolar ridge, of course, behind the upper teeth, and tip and blade of tongue. Tip and blade of tongue. You will feel when you will produce these sounds that, all right, these are the articulators involved in the production of alveolar sounds. T, D, S, Z, N, L, R. I repeat, the class is alveolar. The articulators involved are alveolar ridge, of course, behind the upper teeth, and tip and blade of tongue. And the sounds produced are T, D, S, Z, N, L, R. Okay? Our next class of consonants is platealveolar. 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 And what are the articulators involved? Hard palate, of course, alveolar ridge, the part of alveolar ridge, and tip, blade, and front of tongue. The articulators are hard palate, of course, the part of alveolar ridge, and tip, blade, and front of tongue. You will feel how your tongue is moving towards that area when you produce these sounds. Say after me. Ch, j, j, sh. I repeat, the class is platealveolar. The articulators involved are hard palate, of course, that is the part of alveolar ridge, and tip, blade, and front of tongue. The examples are ch, j, j, sh. The next class of our English consonant is platal class. Platal. When we are going to classify all the consonants, of course, now we are with platal. Platal. And what are the articulators involved? Hard palate and front of tongue. Hard palate and front of tongue. And there is only one sound, that is y. Please, you must make a distinction between this sound and the sound which you heard in the previous slide, that is j. This is not j. This is y. As in yes, yo, yesterday, yogurt, yummy, yeah. Because that sound is j, j. Pleasure, measure, treasure, prestige, prestige, entourage, entourage. So this is your sound. Remember, there is a difference. There is a difference. Always remember. So this sound is different from the sound which you heard. J. But this is y. It is called platal sound, and the articulators involved are hard palate and front of tongue. Y. Yes. Yo. Okay? The next class of our consonants is velar. 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 And the articulators involved are soft palate and back of tongue. Soft palate, of course, velum, and back of tongue. What is the name of class? Velar. And what are the articulators involved? Soft palate and back of tongue. And what are the sounds? K, G, ing. What are these sounds? These are velar sounds. What's the class of these sounds? Velar. And what are the articulators involved? Soft palate and back of tongue. And what are the sounds? K, G, ing, ing, sing, bring. Do you remember? Because many a time I try to pronounce some of the words containing this sound, ing, ing. Of course, that is nasal sound. In fact, as I told you already, that it is nasal sound, just like m, n, ing, ing. But so far as the class is concerned, this is called velar sound. Well, my dear students, the last class of our consonant is glottal class. Glottal class. As I told you, there is only one sound that falls under the category of glottal class, that is her sound. Since the vocal cords are in fact playing the role to produce this sound, and you can find and you can feel that there is no obstruction for air when the lungs, in fact, they throw the air, or rather they push the air upward. What happens, of course, the air has to pass through this area, and that is called the vocal cords, and you can see there is a flow of air, and you can easily and without any obstruction you can feel that you can produce this sound. For example, her, higher, height, high, hello. You can write as many words. You can feel that there is no obstruction for airflow or airstream when we produce this sound. This is the last class of our consonant categories. Now, before we jump to the final part of this session, of course, that is the self-assessment part, which is very important and which is given at the end of each and every session. You must try to recall each and every class of consonants. It's very important because we must be knowing that what are the articulates involved in the production of each and every consonant. And as I told you that there are 24 consonants in an English language. I am referring time and again to English language. Why? Because we must have some sort of model before us, and the model before us is English. We cannot think about any other language except English. Why? Because naturally, when we just complete the first part of our course, that is phonetics, in fact, to understand what is phonetics, of course, the branches of phonetics, and what are the things involved in phonetics, ultimately we have to proceed to the world of phonology. And when we talk about world of phonology, of course, we have to talk about English, and we are bound to talk about English since we shall be engaged in understanding phonology of English. That's why I felt all the time convenient, and I feel at this time convenient, that to talk about English and refer to English, since you already know all the consonant sounds which we have talked about so far. And of course we will be having more drill, and of course we shall be having practice, not during the session, but I'm sure that after the session you people are free, you can engage yourself and you can enjoy learning. But the most important part is whether you are learning or not. Yes, you are learning, so when you are just giving your reflection, that means you are learning. But at the same time, you can gauge learning when you are involved in listening to me and listening to all other instructors. Please allow me to say instructor because that's the professional name, but in fact I am more facilitator of learning instead of an instructor. I always call myself, and of course I always call other respected colleagues, that they are the facilitators of learning, since we are talking to adults. Okay, so this is what we've talked about, the classes of consonants, and we have tried to identify all the classes of consonants, but at the same time we try to understand what are the articulators involved in the production of one particular speech sound, whatsoever it is. And we try to understand the examples of all speech sounds, definitely consonants, and that alright, this consonant or these consonants fall under this class. I hope that you will practice, and the one complete chart, the table, 3-column table, that is a reference table for you. That is a reference table for you. That is a reference table for you. You must all the time refer to this table, because that will guarantee you to understand whenever you are a little bit confused about, okay, what are the classes of consonants, you can refer to that table. Okay. Well, before ending this session, I think it's very important to talk about self-assessment. Definitely I have to assess myself, and naturally you have to assess yourself. I have talked much about this in the previous slide when I was talking to you. But I would like to remind you that don't forget making or preparing a folder. But definitely it is my job to tell you and remind you again and again during every session about the folder which you are supposed to be preparing and making, because without preparing or making that folder, things become difficult for you to manage. Why? Because you people are having many courses, 4 or 5 more courses you are having, and you know it is possible that you mix up some of the material. For example, if instructor A, B or C or D, you know, they are giving you some sort of assignment, and it is possible that you are doing all the assignments together and you mix up the answer sheets. So that's why I always suggest you must have your own folder. Write down the name of the course, and please do not forget writing the course code, and of course the name of the instructor. That's very important. Okay. By the end of this semester, I'm sure you will be a better student, in the sense because you know how to organize yourself and how to organize your learning. The most important thing is the organization of learning. Now you are systematic. I know all the students are systematic, and I trust you people, and I believe in your talent. I believe in your hidden talent, in fact. And the wonderful thing is that if you start recording your voice, that shall provide you a wonderful chance to self-correction. Okay, that is the best part of your self-assessment. And for today, the tasks you need to do are: How would you divide consonants? So you need to explain them, and then reflect your understanding about the organs of speech by drawing. I want you to draw as many diagrams you can. You have seen many diagrams. You can put all these diagrams in front of you. You can draw and you can write name. And if you do twice or thrice, I'm sure that the things are stored in your mind. So this is all from me for today's session, session number 7. We are in the 4th week, and from my side, goodbye and good luck. Stay blessed.